Hi everyone, it's Mikkel. I'm going to give you a quick demonstration on how to use a butterfly needle for specimen collection. And we're also going to do this on a hand vein. Now to perform the collection, we need our butterfly needle, and this is also known as a winged collection set. This works with a normal Vacutainer barrel and collection tubes. In this example, we'll be collecting a sodium citrate tube because of an additional step required when collecting this specific tube. We'll also need our regular collection supplies like alcohol swabs, tape, and a rubber ball or stress ball can be particularly useful with hand collections to add a little more stability and of course a tourniquet. After the patient is correctly identified, you can proceed to tying the tourniquet. With a hand vein, this can be placed roughly 2 inches above the wrist. The squeeze ball can be used to support the hand. Alternatively, the patient can make a fist, wrapping the fingers underneath the surface of the hand and placing it directly against the table or the bed where you're performing the collection. When locating a vein, choose a straight section on the top surface of the hand. Avoid intersections where the vein branches into a V-shape. The vein I've located here is anchored well and is in an area where no branching is observed. Once the vein is located on the hand, the tourniquet is released and we cleanse the side as normal using a back and forth scrubbing motion. While the side is drying, we can assemble our butterfly needle. Names vary between manufacturers, and in this example we're using the Safety Lock system from BD. You can see here that it's a 21 gauge needle. 23 gauge sets are color-coded blue and are useful with smaller hand veins and pediatric patients. We open the package, removing the needle as well as the plastic wrapper holding the tubing in place. The needle itself is protected by a plastic cover and should never be removed. We only remove this just prior to the insertion into the vein. The wings shown here is what gives the needle its name. They look like a butterfly and they have small grip pads to get very precise control over the needle. The Vacutainer barrel is attached on the opposite side of the tubing by screwing it onto the threads. A very important note about using butterfly collection sets is the need to collect a discard tube before the sodium citrate in the order of draw. As seen here, the tubing contains a lot of dead space that is occupied by air. We all know how important the fill volume is with sodium citrate tubes. Without a discard tube, all of this air would end up into our Vacutainer, making them underfilled. The discard tube gets rid of all that air in the line to avoid this from happening. Once the tourniquet is reapplied and my supplies are arranged so they are easily accessible, the butterfly needle is gripped by the wings. The needle cover is removed to expose the bevel. As hand veins are located close to the surface and tend to roll, the thumb is used to pull back on the skin tightly just below the site of insertion to anchor the vein in place. Adjusting the angle slightly below 30 degrees, the needle is inserted into the vein in one smooth and continuous motion. Once the needle is inserted into the vein, the butterfly contains a small window that fills with blood. This verifies that blood flow is established and is often referred to as getting the flash of blood in the needle, indicating that we can now engage the Vacutainer. Also note that I'm stabilizing the butterfly using one of the wings to prevent the needle from moving. However, if you're collecting from the arm, the wings will often stabilize the needle on its own, freeing up both of your hands. The discard tube is engaged first. Notice that the line fills with blood, removing the air. Once the line is full of blood, the discard tube can be removed and the sodium citrate tube that will be tested is engaged and filled. You can then proceed to collect any remaining tubes requested following the normal order of draw. When complete, the needle is swiftly removed by pulling backwards and the cotton ball is applied with firm pressure. So this is a fail on my end. I clearly dropped the butterfly needle here, but I'm glad this happened Because the needle is so small compared to a regular collection needle, it can be sometimes hard to manipulate, so be extra careful when handling them. I carefully pick up the needle by the wings and slide the yellow safety device in place to cover the needle again. This is then disposed of in the sharps container. You then follow all the usual steps, including ensuring bleeding has stopped, offering a bandage, labeling tubes, and disposing all the garbage.